Welcome to The Explainer. Today, we're going to talk about one of healthcare's most effective, but kind of overlooked, secret weapons. It's a potential solution to a massive challenge we all face, just trying to get the time and expertise we need from our healthcare system. But before we jump into the solution, we really have to get a handle on the scale of the problem. So let's set the stage with a crisis that's, well, it's quietly brewing in doctors' offices all across the country. I mean, it's a question so many of us have asked, right? You call to make an appointment, and the wait is weeks, sometimes even months. And look, this isn't just an inconvenience. It's a huge red flag that our system is under some serious strain. Check out this number. According to the Association of American Medical Colleges, the United States is on track to be short more than 55,000 primary care doctors by 2033. That is just a staggering gap between the doctors we have and the doctors we're gonna need. And for the physicians we do have, they're facing a pretty overwhelming workload. A huge part of their job is just managing chronic care, juggling all these complex medication plans for diseases like diabetes and hypertension. And that is a major, major reason why so many doctors are burning out. So, okay, we've got a shortage of doctors and a system that's totally overburdened. So where do we find help? Well, the answer might actually be hiding in plain sight in a place most of us visit pretty regularly. Yup, pharmacists. Now, I know what you're thinking. They're the experts who dispense medications, but for decades now, their training has been at the doctoral level. They are literally doctors of pharmacy, and they are prepared for a much bigger role in taking care of patients. And hey, don't just take my word for it. This quote actually comes from a physician, writing in Forbes. He argues that pharmacists are just perfectly positioned to help reinvent primary care by letting them take on more responsibility for the one thing they know best: medications. So what does this expanded role actually look like? Well, it goes way beyond just dispensing pills. Pharmacists are trained to manage chronic diseases, to adjust your medication dosages, to order and interpret relevant lab tests, and even coordinate your follow-up care. They are, in short, medication experts just ready to be deployed. So, what happens when we move these experts from behind the pharmacy counter and embed them directly into the primary care clinic, making them a core part of your care team? Well, the cornerstone of their work in this new setting is a service called Comprehensive Medication Management, or CMM. It's really a patient-centered approach to make sure every single one of a patient's medications is appropriate, effective, safe, and can actually be taken the way it's prescribed. A typical CMM visit is way more in-depth than just a quick chat at the pharmacy counter. We're talking about the pharmacist assessing your entire medication list, working with you and your doctor to create a detailed care plan, and then scheduling follow-ups to make sure that plan is actually working and you're hitting your health goals. Now, the key that really unlocks all of this is something called a collaborative practice agreement. Think of it as a formal agreement between a doctor and a pharmacist that allows the pharmacist to perform specific patient care functions, like adjusting a blood pressure medication without needing to get the doctor's okay for every little change. Okay, so this whole team-based model, it sounds great in theory, but what happens when you actually put it into practice? Let's look at the evidence from two very different healthcare settings. Our first stop is a big academic medical center in Wisconsin. They decided to put pharmacists right into their primary care clinics to help manage patients with uncontrolled high blood pressure. And the impact? It was dramatic. After just 1 year, nearly 75% of the patients working with one of these embedded pharmacists got their blood pressure under control. Now compare that to the patients who got the usual care. Only a little over 40% hit that goal. That is a massive improvement. All right, our next case takes us to a totally different environment, a rural family medicine clinic in Hawaii. Here, the clinical pharmacists were focused on helping patients manage all the complexities of diabetes. The results here were just as stunning. Think about this. Before the program started, fewer than 5% of patients were meeting all three of their key diabetes goals. After working with the pharmacists, that number skyrocketed to over 30%. That's more than a 6-fold increase in success. Wow. And digging into the details really shows you how this happened. The percentage of patients meeting their blood sugar goal, it more than doubled. And even more impressively, the rate of patients controlling their blood pressure shot up from 43% all the way to nearly 86%. That is a truly remarkable turnaround. So the crucial takeaway here, and this comes right from the Wisconsin study's conclusion, is that the evidence is consistent and it is clear. Integrating pharmacists into the care team directly improves health outcomes for patients with chronic diseases, period. So what does all this evidence mean for the big picture? I mean, this isn't just about adding another person to the clinic. It's about fundamentally rethinking how we deliver care so that it's more effective and more efficient. This model really addresses what experts call the quadruple aim. We've seen the better patient outcomes for sure, but it also aims to lower costs, improve the patient experience, and, this is a huge one, improve the provider experience, helping to fight that burnout problem we talked about right at the start. This all points to a really simple but powerful framework for reorganizing care to be as effective as possible. Sometimes it's called the 5 Ps of care. The goal is really simple: to get the right patient to the right provider in the right place for the right price with the right pharmaceutical. And what we're seeing is that for complex medication challenges, the pharmacist is that right provider, and that frees up the physician to focus on diagnosis and other complex issues. So this all leaves us with a pretty powerful question to think about. What could your healthcare look like if a medication expert was a fully integrated member of your care team? This model suggests it's not just a nice idea. It might just be the secret weapon we've needed all along.